Around the clock, a team of dedicated veterinary heroes fight to save lives.
Tell me a little bit about what happened.
Start some oxygen.
Wow, look at that.
Basically, they're as full as the stomach gets.
We'd be dealing with a very complex surgery. We just don't know what we're going to find in his stomach.
Can you bring me a crash box, please?
At this stage, his heart rate is so fast, he's in danger of actually having a heart attack. He's still there, my friend.
Puppy is at risk of passing away as well.
The heartbeat is just not great.
Very faint. Come on.
The risks are really high. It's not going to be easy. What if we can't get it out?
It's Bondi Vet, as you've never seen it before.
When you bring this guy back, it's going to be a freaking miracle.
On this episode of Bondi Vet ER,
Poor girl. That would be so painful.
Luna has been rushed into Alex with shocking injuries.
She's only a little dog. The car hit her at speed. It's quite shocking. The leg is shattered.
You get some adrenaline?
Gerardo desperately tries to save a newborn puppy.
My thumb and finger are the only thing that is keeping this puppy alive.
Come on, little one. When you bring this guy back, it's going to be a freaking miracle.
Oh, Ollie, you silly boy.
And a sock has gone missing, and Ollie is facing serious trouble.
It's not in his stomach. It's going to be a really dangerous situation for him.
Hey Patrice, can you give me a hand with this girl?
On the Gold Coast, Alex is about to examine one-year-old puppy Luna, who's been rushed into emergency after being hit by a car.
She's definitely in a degree of shock. I've given her some pain relief, but let's get her on some oxygen. Poor girl. And I just want to check out her wounds because she looks like she's got some pretty nasty injuries.
Owners Hope and Liam are devastated by what's happened to their precious girl.
We accidentally left the side door open and I heard the car and I just felt like something was wrong and ran around looking for Luna and couldn't find her, so I went out the front and then she was just hobbling over to me. Her front paw was all floppy, pretty devastating.
All right, let's see what's going on. I'm just going to go nice and slowly. I'm just going to start at the back. Good girl, darling. It doesn't look very good back here. There.
Oh, darling.
Yeah, I can see underneath here. She's got wounds. Looks like she's been dragged along. Oh, yep, and on her belly too. Oh, she looks like she's got grazing all along her tummy. That would be so painful. Of course, we don't even know what her internal injuries are. With hit by car patients, you become extremely concerned about injuries like internal bleeding and head trauma. But I can already see she's got significant external injuries. Oh, look at this, she's even got little wounds on her head. She's literally must have just tumbled along the ground. I don't want to touch anyone that hurts too much. I'd be pretty worried with the amount of her injuries, eh? Okay, I'm just gonna have a listen to her chest. You're such a sweet girl. It's okay. Chest sounds okay. Yeah, I think we're definitely gonna have to do some x-rays. Yeah, see how bad the damage is, but she's only a little dog and if the car hit her at speed, yeah.
Some damage back there.
Yeah.
Shall I get her sit up and...
Yeah, if you can pop her in a bed. Okay, I'll come back and see you, all right, sweetheart? I'm gonna fix you up. I'm just giving Luna some fentanyl now, which is a very strong form of pain relief. She's got some severe injuries there. We don't really know the full extent of it, but any dog that's come into contact with a car with the injuries that she's showing at the moment has got to be in a lot of pain. We're going to bandage Luna's wounds to prevent any further contamination and also it'll make her more comfortable.
Luna's distraught owners are anxiously waiting for any news.
I've organised for Hope and Liam to come through and see Luna. It's been a very distressing time for everyone. It's important that they have a chance to see her.
Lie down, lie down, lie down.
If Luna was my dog, I'd want the chance to give her a cuddle. Okay. Just down here. okay? You all right? Hey, Luna, look who's here. Look who's here. Oh, sweetheart. Oh. Okay. It's all right. You're awake. Good girl. It's okay. You see them soon, sweetheart. Know what some of Luna's injuries are, but I am starting to get worried about that left front leg, which she doesn't want to use, and she keeps holding it up. And if it's broken, we'll be able to see on the x-ray. But sometimes the injuries that we can't see can be worse than the ones that we can. I'm really worried about you, sweetheart. Yeah. Get you some more pain relief before we even move you. Luna's more painful now than when she came in. Often what happens is when they first get hit, the adrenaline's going and they're not feeling the pain so badly. She's been here for a little while now and I think it's really starting to kick in. So we want to take her through to x-ray, but I think before we even move her, we need to give her some more pain relief because she's really uncomfortable. Good girl. There she goes. Hey. There we go. That's better. Okay, let's go. Good girl. Good girl. All right, sweetheart. I take the first set of x-rays of her chest. I'm looking for collapsed lungs, broken ribs. The chest actually doesn't look too bad. So there's no collapsed lung there I can see. Let's take the other side and have a look, but that's not as bad as I thought actually on her chest. Next, we're going to x-ray her pelvis and her limbs. We're looking for fractures and dislocations. Okay, let's drop her the other way. Looks pretty good from that angle. Luna's pelvis is intact and doesn't appear to be damaged. That's good news. Okay, let's look at this front leg. Oh, let's see what's going on in there. Okay, moment of truth. Let's see. Oh, wow. No. Oh, that's a nasty fracture. Look at that.
She's not putting any weight on it.
No, that's... We take the x-ray and it's quite shocking. The leg is shattered. She's got a completely free fragment there as well. That's a really nasty fracture. Luna's humerus, which is the bone that goes between her shoulder and her elbow, is in 3 pieces. It's a devastating injury, but as an emergency clinician, you need to keep moving forward. You can't get caught up on one thing. We need to do a fast scan. The purpose of a fast scan, it's a trauma scan essentially. So what we're looking for with Luna is any free fluid in her belly. If there's fluid there, it's going to be either blood, so internal bleeding, or she could have ruptured her bladder or ruptured her gallbladder. We're not looking at organ structure here, we're just looking for fluid. And I can see there that her bladder is intact, which is good. Okay, so I'm just looking at her kidney, looking for any fluid around there at the moment. I'm not seeing any, that's good. She's still in trouble, but not as much trouble as she might have been if she'd ruptured her spleen or her liver or anything like that. I know that Luna won't go for surgery for another day or so. Her contusions need to heal and there's swelling there that needs to resolve. Let's go. You all right, darling? Okay, all right, let's sort your wounds out. So the plan for tonight is really going to be to clip and clean these wounds. They're heavily contaminated. There's literally bits of road in her wounds. So we need to clean as much as possible, bandage them. Some of this skin may also die off. So we need to wait and see what's going to survive and what's going to die. Poor girl, I think she's going to be in hospital for quite a while. Tomorrow she'll be transferred for the repair of her fracture and then the ongoing treatment of her other injuries. She's a beautiful dog with a wonderful family who love her dearly, so we're going to do everything we can to get her home. I got that leg. I'll leave you to rest for the night, hey? Good girl. You're a little fighter, aren't you? You hang in there.
As a vet, the best advice that I can give pet owners is this. Think carefully about the choices that you make on behalf of your pet, and you can literally save their lives. And if you make healthy choices, you will have a healthier pet.
I hope she's still okay.
A new mum is in trouble, and Gerardo is rushing to help.
Just came with surgery, and I've just been informed there's another surgery that we need to rush into, and it's for a dog named Bonnie who is struggling to give birth.
She's already given birth to 3 live pups, but the last pup is stuck.
She has one more in there, but the heart rate of that one that's in there is low. So it means that that puppy is at risk of passing away as well.
Gerardo needs to perform an immediate emergency caesarean to try to save the puppy's life.
Take you to surgery, sweetie, and we'll get that last one out. You're right. Good girl. We're about to induce anesthesia and Bonnie, but before we do that, we're going to clip and get as many of the things done as possible, because once we induce anesthesia, there's a risk that the puppy may die. We'll get all the clipping done now, Bonnie, so that you are under anesthetic for the shortest period of time. Okay. You know, $500,000 is quite a lot, but she probably hasn't any pre-med yet. There we go, sweetie. Just flush that through. Give that a couple seconds. Because the puppy's heart rate is low, there's a risk of it passing away under anaesthetic. So we've got to get in there and get it out as quick as possible. We'll have a team out here ready for when it comes out to help resus. Oh yeah. I hope she's still okay in there. Okay, Bonnie. You ready to cut? Yeah. Okay.
First incision. No going back now.
You want to cauterize? So thin. You went into the abdomen. Okay. Extending. Cutting down. We've got a scissor to extend and met some bones.
What we're going to do now is open her uterus, pull out that puppy, hopefully it's still alive, and pass it on to one of our team to perform resuscitation.
Oh. There we go. Okay, guys, ready? Head, puppy, just pulling gently. There we go, it's coming. The placenta's coming. Ready? Go.
The puppy is out, and it's a girl, but she's barely alive.
The way that we resuscitate puppies is by rubbing them vigorously with a warm towel. This helps stimulate breathing and also helps remove fluid from their lungs.
As a heartbeat, it's just not great.
The tiny girl is close to death.
Come on.
Every second is critical.
You got it?
Yeah, it's heart rate. It's like one beat every couple of seconds.
You get some adrenaline.
At this point, we're going to try anything. So we're going to give some adrenaline into the puppy's mouth, and hopefully that will stimulate the heart to beat harder and faster.
And there.
Gerardo and the team are working frantically,
Come on.
but so far, the puppy isn't responding.
Still nothing, Ben?
Yeah, it's still got like heartbeat.
Come on, little one. Come on, little one.
The puppy has a heartbeat, but it's incredibly slow. Only 2 beats every 15 seconds. So I'm gonna have to start chest compressions.
Come on.
My thumb and finger are the only thing that is keeping this puppy alive.
There's 2 breaths there. Come on. Come on, little one. So we're trying to resus the puppy. It's come out and it's not very responsive. It still has a heartbeat, but it's very slow. And it is taking breaths, but intermittently. We've got oxygen going on, we've got heat going through, we're suctioning fluid out. It's actually pretty hard to work on small little babies. Come on. No, that's 2 breaths. No. Come on, little one.
We've got all hands on deck, but we're running out of time.
That's another breath. Come on, little one. We bring this guy back, it's gonna be a freaking miracle. You want to wheel the ultrasound over?
We've been doing CPR for a really long time now, but before we give up, we're going to do an ultrasound first to see if the heart is still pumping.
Come on. There it is. Oh, there's a heartbeat. There's a heartbeat. It's slow, but let's keep going. We'll win. Come on. Gosh, it's a good thing we did that ultrasound, otherwise I was about to give up. I'm not very hopeful. Come on, but we got it. Come on.
To our delight, we are getting some results from our efforts. The puppy is breathing, although not very often, and its color is now starting to become a bit more pink.
Drop of atropine as well, please. Come on. I wonder how long she's been struggling in there like that. Come on. Come on, come on, come on. Put her down. Oh, that's more frequently now. I can't wait till we hear that.
Right, exactly.
We're like,
so satisfying.
oh, that would be so, yeah. That's one breath every 10 seconds, so one in. She's breathing more frequently now. Oh, yeah, it's once every 8 seconds. Come on. Come on.
The one thing that we all look out for when we're resuscitating puppies is its first cry out. So we're not going to stop until we hear that.
Hey, look at this. Look at these little paws. They're looking a bit pinkish now. Oh yeah. I can feel it. We're only moments away from a big red nose and a...
Suddenly, it's the sound everyone has been waiting for.
That is so cute. How long is that squeak in the making? That is like nearly an hour. An hour.
It is amazing to hear that sound, and you never get tired of it.
Oh, little one. Hey, you're like, stop rubbing me. It's been an hour. Do you reckon she's good to go back with the rest? Yeah? Okay, great. Hey, little one, everyone's been working really hard for you. You did a good job.
The puppy's color is pink, it's moving around, it's breathing on its own, and it's crying out. Success. Now it's time to put it with the rest of the puppies and see if we can get it to suckle.
Oh, little Bonnie. You saved your little puppy. It's a little girl.
Bonnie is now letting down milk and the puppies are suckling. It's amazing to see this, and it is an incredible ending to a very stressful last couple hours.
You did a very good job. Good job, Bonnie.
Hey, Dr.
Hey.
Naughty Ollie has been rushed in.
His owners are really worried he may have eaten a sock.
All right, well, let's pop him up on the table and we'll have a good feel of his belly. Come on, Ollie. Come on, matey. Ready? 3, 2, 1.
Vet Brooke needs to act quickly.
Alrighty.
Owners Eric and Roberto are worried their cheeky cavoodle's bad habits may have landed him in serious trouble.
Typical puppy, he likes to just eat random things, dig, bite things. Recently he's had a fetish with socks.
So we think you've eaten a sock, but we need to give you a good check over and make sure everything else is okay and make sure you don't have anything else going on that's going to complicate things. Got nice pink hydrated gums, which is great to see. All right, so I'm just having a feel of his belly at the moment, and he's certainly a little bit uncomfortable in there. So I do hope that you don't have a sock in your stomach. or stuck in your intestines. Our plan is to really make him vomit with some medication and see if he can bring a sock up. And if it's not in his stomach, it's already passed into his intestines, which is going to be a really dangerous situation for him. This is a medication called apomorphine, and it's one of the safest and most effective ways to make a dog vomit. This medication will make Ollie feel nauseous. That is the purpose of the drug, but he's not gonna like it and he's going to feel pretty miserable. Okay, Ollie, we're gonna have to rub this on your gum. Good boy. Ready? There we go. It doesn't taste very nice, I know. Good boy. Ugh, terrible. Good boy. He is less than impressed. I'm really hoping that the sock comes up in his vomit, meaning it stayed in his stomach this entire time. And now we wait. They start lip smacking. That's the first sign that they're nauseous. Oh no, nothing yet. So the first bit of vomit is a little bit of bile and saliva.
There we go.
Come on, mate. Oh my goodness!
Good job, Ollie.
Good job, Ollie. But Ollie's second vomit is miraculously half a sock. We are very, very lucky that he brought that up. And you're joking. Oh my God. So in the final vomit, the second half of the sock comes up. Oh, Ollie, silly boy. This is really the best case scenario, because if even part of this had passed into the small intestine, he would be looking at emergency surgery for the removal. And now he's gonna have some anti-nausea medication to stop him from feeling so sick. And we'll be able to discharge him home today, which is a great outcome. All right, you can go into bed until you feel better. Good boy. It's such a relief for me to be able to send him home today. We never wanted to take such a young dog to surgery, and to be able to avoid that and get such a good outcome is the best part of my day. Okay, Ollie, it's time to go home. Good boy. Such a great outcome. Do you think he'll do it again?
Of course.
We'll probably see you next month. Oh, he's such a good boy though, despite it all. He's so beautiful.
Yeah,
I'm glad he still likes us despite us making him vomit every time.
Yeah. Well,
Oh,
I think that's a bit of a problem, because every time he eats something, he's always still very happy, so we can't
Yeah.
actually tell if there's something wrong.
So it's only if we find it missing in the wash that
Yeah, that's
we
it.
start to get worried.
So we need to always make sure we count our socks. That's our new thing now.
It's essential. I mean, if you hadn't have brought him in when you did,
Yeah.
we would have been in a lot of trouble. So
Yeah.
super, super lucky that you guys made that decision.
Exactly.
Saved him. I really do hope that I don't see Ollie in my emergency department again. But given his history, I'm not too sure. So I hope you have a good rest of the day, and I hope we don't see you anytime soon, Ollie.
No. But you're better right now.
Hi, I'm Dr. Danny Dusek. If you love our show and want to see more amazing stories from the Bondi Vet team, just hit the subscribe button. Click that little notification bell and we'll see you for our next video.